If you're dealing with lower back pain, here's what's actually going on, and more importantly, what actually helps. Because if you've tried resting, maybe take a medication, and you keep ending up right back in the same place, it's not just your back. It's that no one has shown you the right path forward. Let's fix that. Low back pain isn't one condition. It's a symptom, and it's usually the result of dysfunction somewhere in the body. Your lower back carries a ton of load every day. So when a disc, joint, nerve, or muscle isn't doing its job, pain shows up. But here's the deeper layer most people miss. This isn't just structural, it's neurological. Your brain and nervous system are what control movement, stability, and coordination. So when that system isn't communicating well, your body compensates. And over time, those compensations break down. This is why people get stuck. Pain flares up, you rest, it settles, then it comes right back. Because nothing actually changed. What's really happening is there's a gap between what your body is being asked to do and what it's capable of handling right now. And when your deep stabilizing system, your core, your spinal stabilizers, isn't being properly coordinated by your nervous system, your discs and ligaments take the hit. Add in sitting, stress, and repetitive movement, and now you've got a system that keeps failing under load. The good news? The gap is measurable, and it's fixable. This is where we do things differently. Before we touch anything, we measure. We look at how your nervous system is functioning, how your body is moving, and where the breakdown is actually coming from. Yes, we go through your history and symptoms, but we also use objective testing, movement analysis, and neurologic scans when needed. So we're not guessing. We're identifying the root cause. Because if you don't understand what's driving the problem, you end up chasing symptoms. And that's why people stay stuck. Once we have clarity, the plan becomes very straightforward. First, we put out the fire. Reduce irritation, calm the nervous system, and get you out of that pain cycle as efficiently as possible. But we don't stop there, because if all you do is chase relief, you end up right back where you started. So phase 2 becomes about fixing the foundation. Restoring movement, rebuilding stability, retraining how your body actually functions. Then we build real strength and durability, so your body can handle your life again. And finally, we transition you back to doing everything that matters, with a plan to keep it that way long term. Depending on your case, we may layer in advanced tools to accelerate progress. Things like shockwave therapy to stimulate healing in stubborn chronic tissue damage, or spinal decompression to reduce pressure on discs and nerves in cases like injuries or sciatica. But these aren't random add-ons. They're applied very intentionally based on what your body actually needs. Everything we do is tied back to your specific findings. Quick example. We had a patient, late 40s, office job, 9 months of back pain with pain going down her leg. She couldn't sit comfortably, she had stopped walking, and her sleep was off. We identified the underlying dysfunction and built a structured plan. And within a few weeks, things shifted. By week 4, she was back to walking. And by week 8, she was feeling more confident in her moving again. Not because we masked the pain, but because we addressed what was actually causing it. If this sounds like you, your next step is simple. Book a consultation. No pressure, no generic plan. Just a clear understanding of what's going on and what it's going to take to fix it. You can book online anytime or call the office. Let's get you moving forward again.